Welcome to the Better Half Show. My name is Godman Akinlabi, PG to my friends. This episode is all about how marriage and relationships affect our mental health. I'm going to be joined in the studio by two medical practitioners, and we're going to be looking at how to put safeguards in place to be mentally sound in the midst of marital and relationship issues. Don't go away, stay with me, and I'll be right back. Welcome back. It's a Better Half Show, and we're discussing the effect of marriage and relationships on our mental health. And I have joining us in the studio, Dr. Nobi. Dr. Nobi, can we get to meet you? By the way, welcome to the Better Half Show.
Thank you very much. It's good to be here.
All right. Can we get to meet you and your area of practice, how long you've been in practice and stuff like that? Yeah.
Well, I'm Dr. Oluseun Peter Nobi. About 13 years being a doctor. I'm 10 years now in the field of psychiatry. I'm a consultant psychiatrist, and I lecture in the University of Lagos Department of Psychiatry. And I have a private psychiatry home, and also I'm involved in mental health advocacy everywhere.
All right, let's jump right in. Dr. Nobi, can you talk to us about maybe some of the worst cases of degraded mental health occasioned by marital situations or situations in relationship? Yeah.
Well, the truth is, examples abound. I mean, I remember as a resident doctor, one of the clues that when you get to the ward, then if you have like 8 women on admission, you can be sure that 5, as much as 5%, 5 out of those 8, if you ask them, oh, madam, what's the problem? Well, my husband, my partner. So after a while, it became that even if a lady is coming on admission, as a junior doctor then, you could just predict. If it's in exam, you see a woman and everything, and you are thinking of precipitating factor that could have led to this thing, you will not be wrong if you say there's a relationship problem.
I'm sorry if I jump in here. I remember I had an aunt that took my friend, her daughter and I to psychiatric hospital. She went to visit someone, and literally, I'm not kidding you, and she pointed, said, Ele, that's this one, Okoeni. This one, Okoeni. This one, Okoeni. So when she talks to us about relationships, she would literally say, one thing I want you to know, don't let a man affect your mental state.
Exactly.
So it's so relatable.
So she pointed to 3 women.
More than 3, you know, she was
them,
just,
they became mental cases because of their husband.
Yeah.
Wow.
It's a major problem. And you begin to ask yourself, why should it be? And I like one thing she said. Right there, she was told, never allow. So a resilience was built in her. And that is the key thing now. People need to understand that marriage is very wonderful. Relationship is lovely and everything. But it is also a precipitant or aggravating factor to emotional problem. And it is not far-fetched. Apart from your job, apart from spirituality, relationship and love affair appears to be another thing that people hold so much in connection to. When you're in a relationship, it talks about your soul. You've seen people when they worship God or they are worshiping anything, they'll be crying, they are connected. So also, the one you say you love so much, therefore, any other person in this world can offend me. But when it is my spouse or my partner, my fiancé, I am going to feel it deep down. And when you begin to, so there is internal trauma. And that internal trauma is like the same way like caterpillar jam somebody.
Wow.
So that is why you now see people crumble. And the next thing is, if the resilience has not been built, they just fall flat.
There will be a crash. Now, what are the extreme cases? How bad can this get, doctor?
Well,
from the examples of people.
Yeah, the truth is that it now depends on individual coping mechanism, personality, different things. Some people will have emotional problem due to relationship or marriage, and they will go right into depression, which we will talk about. Some, because they are trying to cope, they take into abnormal coping strategy. We have normal coping strategy, abnormal, we will talk about that. But the abnormal coping strategy, these ones, they may involve themselves in a extramarital relationship and they feel guilty about it and go into depression. Some begin to smoke, drink, their personality changes, all because they just want to cope with the situation at home. Some become manic and some become outrightly psychotic. Yeah. So it depends on many factors to now say which will individual now evolve into.
So let's talk about, you've talked about coping mechanisms and different things. Those are on the personal basis. Now, let's talk about giving care. How do we even start when people have gotten into, whether in the mild stage or the very serious? How do you even start? Most of the people following us on the show today are not medical practitioners. They're just people who just want to care for people. Where do you even start from?
Well, the truth is, individual in a relationship must first of all assess that relationship. Is this relationship a blessing to me or a curse? In the sense that, is it causing me ailments emotionally, or it is such a blissful one? There's no perfect relationship. However, we say that. Yeah. Hurt here and there, and then you move on. But when relationship is constantly, there are infrictions every time, and then you see your mood, or when you see your partner, your heart skips. You don't want to go out. You don't want to go to your house. You just want to. You feel like sleeping on the road and everything. Self-assessments. Once that is there, the next thing is you cry out. You cry out to friends, social support, which is also very important.
But Dr. Nubi, sometimes it's not so easy to self-assess yourself. So I think sometimes another thing we can look at is people looking out for those telltale signs that you can see. Yeah. Like with the person I know, it's easier that we could tell that she gradually withdrew. So availability, she would never. So
for people to be able to see those telltale signs and say, oh, something is going wrong with my friend. This person is now becoming quiet. Yeah. This person, or this person is now talking too much. And this is somebody who wasn't really talking before, who is not a talkative. Yeah, not talking so much. So you have to be able to pay attention. We always
live in a state of not being able to assess ourselves sometimes. Yeah. For her, for a long time, I don't think she thought of it that I wasn't being there. She just gradually just moved away. Yeah,
you're very right. What we do is that the essence of this is to educate. Yeah. We naturally train people to assess themselves. When I go out and I talk about mental health promotion and education, I always begin with you. Okay, yeah. What you have said is perfect. People usually don't. Essence of program like this is to make individual watching to begin, because it starts from you. Oh, yeah. We accept that you must not die in closure. So therefore, we are saying, start from your own self. Okay. However, we understand the fact that people around need to understand the red flags. This person that is not talking, because some people just, as you said, they just don't want encroachment. It's my problem. It's my cross. I will deal with it. And some messages, family will say, don't go anywhere. Oh, we will not know Oko and we will know Ali. That is, we must not know the real husband and we will know another person. This one will say, you have been in several relationships. You want to leave this one? And the question is true, I've had 4. And this is the last relationship. We're already hoping of getting married. Should I leave this one too? So many things begin to come up. And then they don't want to talk. They shut off. They know they are going through it, but they just shut in. So people should now, friends, family, sisters, brothers, should come together. First time when they say, what's wrong with you? What's it? It's my home. Don't worry. It's my life. There's this sense of resentment. They want to put you up. It's like, I'm trying to help you. But it really does not matter. You must continue to until you get that person. And when it gets to us, we start from there.
Thank you. Now, let's examine, this particular scenario. People often say that some things are already there and you just have triggers. So some people already have existing medical health situations that they're not even aware of. So when you get into an intense situation like relationship trauma and all that, then it triggers it. What do you say about that?
Yeah, you're right. You're right. There are 3 P's we follow in medical parlance, especially mental health area. The first P is predisposition. That is, what could predispose an individual to mental illness? Is it genetic, biological, hereditary factors, and co? That is, maybe the parents had that illness. So most of the time, there's nothing we can do about that. If the person is coming to us with mental illness, he was predisposed and he has shown it. But we now deal so much on the 2P. The second is now precipitating. What are the factors surrounding this person's life that is making this illness to now come up? He could be predisposed to it, but he may have lived 120 years without it, if not for these precipitating factors. So we now identify the precipitating factors, and if relationship is one of them, we mark it. That is something we will work on. If it's an aversive relationship that we have to talk, if, for example, if a life is involved as a form of threat to life, we may avoid separation at that time. Or we do couple therapy or adaptive therapy. And then the last P is the perpetuating factor. That is, even after you have used antidepressants, you have admitted, you have counseled, you've done everything, they still go back home. What are the factors in them?
The things that make it continue.
So we take care of that as well.
Wow, that's very enlightening. So the 3 Ps are the things that we need to be
predisposition,
predisposition,
and perpetuating.
But what precipitates it, what
And
makes it
perpetuates
continue, so that's in perpetuity. Wow. As you can see, this discussion has been very, very enlightening. I do want you to go away. Please stay with me. When we get back, we're going to look at how can we manage emotional breakdowns, how can we deal with mental health issues that are coming out of relationships now that we have established that they do come out of marriages and relationships. I'll be right back. Stay with me. Welcome back. It's a Better Half Show, and we've been discussing the effect of marriage and relationships on mental health. And I have 2 doctors on the show today, and they've been giving us very enlightening nuggets on how to take care of ourselves when we get into mental health situations occasioned by relationships and marriage. Now, Dr. Nubi.
Yes, sir.
In this part of the world, depression is something that we're not concerned about. From what I hear,
that's true.
Many people walking on the streets are depressed. But mental health is not something that is written on your face.
Exactly.
So most people don't even know their state of mental health.
Right.
How can we help people to be more aware of themselves mentally and to be more aware of their state as regards depression?
Thank you very much. It's so sad. Just as you said, what you mentioned now is a problem that we are battling with, making emotional and psychological illness, making it appear so real to people, the same way cancer, hypertension, diabetes, the same way those ones are real. Naturally, people will go to hospital if their BP is high, or they have hypertension, diabetes, and co. But when it comes to emotional problem, the next thing is, you can, come on, be a man, get over it. When I was your age, I used to. So at the end of the day, the analogy I always give is, a man that has low blood, which is anemia, his blood is supposed to be 40%, but it's 20%. Naturally, the symptom is that he's going to be very weak. And you now tell that man, stand up and be a man. Even if he wants to, he cannot until you do blood transfusion or blood tonic. Same way, somebody is depressed, for example. Somebody has an emotional problem that deals with chemicals in the brain being affected. The same way our blood is reduced and the person is weak. So also, when these chemicals in the brain are reduced, the same person cannot do what he would naturally do, or he will do it in an abnormal way. But because it is a behavioral problem, we just say, come off it. And that's why platforms such as this is educational for people to help those that have emotional problems. That's when people say they're tired, they're not talking to people, they are withdrawn, they don't see things good in life, they are pessimistic, they are suspicious, they're paranoid. They are not just to be taken as, what's wrong with you? See this one behaving another way. Begin to look at it that this is also a medical way. Yeah. And the way you are going to help somebody that has fever,
It's the same way you should.
That you rush the person to hospital. Same mentality is the way you should help somebody who has emotional problem.
So there should be a clear difference between clinical depression, because a lot of times people can just sit down and say, I'm depressed, I'm depressed. It's not the same as clinical depression. Yes. It is a medical condition. And like you rightly said, there are symptoms that you just look out for. Someone is withdrawing, someone starts to tell you, I'm so tired of life. You know, those are telltale signs. And I think it's for the fact that we're the way we are from, you know, we're not very emotional as blacks or Africans. We don't tend to show emotions because it makes you sort of look weak or a weaker person. But I think we should start to remove our mindset and know that those are actually things to
please, I need to, sorry sir, please, okay, I need to quickly, she has said something very key and very important. Yeah. Africans do not come to hospitals to say they are depressed. They do not tell anybody they are depressed. Therefore, what they do is that they somatize. Somatization is another way Africans reveal their depression. What is somatization? Today, I'm having a day. Tomorrow, typhoid. Every time they are going to the clinic. So when we begin to see somebody, we tell general practitioner, somebody is coming, headache, leg, my head, everywhere is paining me.
That's the example I was trying to give with that. I'll see a patient and they literally tell you, oh, I have a headache today. Tomorrow, I just start to ask you other questions aside medicine. So exactly. How are you doing?
You will get
How is your husband?
You will get
How's your wife?
You will get
What do you do for fun? What, you know, in fact,
and then they start to talk.
They start to talk.
Can you imagine? That's when you start to hear things.
They start crying.
The GP becomes the counselor.
So there's weeping spells. So that's how I think, you know, I've started to look into mental health in my place of practice. Because you go beyond complaints. You start to involve yourself in their emotional state.
That's great. That's great. So let's talk about antidepressants. Okay. How safe are they?
Well, the truth is that it is not every case of depression, just as you said, will be placed on antidepressants. We have mild, moderate, and severe depression. It depends on the behavior. If, for example, someone just feels unhappy, but is still able to walk and do everything, that at best will be taken care of by psychotherapy, counseling, what is making you unhappy and co. But when it now becomes, I'm unhappy, I'm feeling weak, and then I'm beginning to see life as worthless, helpless, and everything, you are moving to a range of moderate depression. At that moment, you may still begin to counsel alone. But when somebody now keeps to himself or herself, doesn't talk, doesn't want to eat, is in a very sober mood, of having guilty feelings, or they are now hearing voices, or they are becoming suicidal, they are beginning to see life as nothing and worthless. They see themselves as a sense of helplessness, hopelessness, worthlessness. It is now becoming severe depression, where you now begin to use antidepressants. You admit such a patient because he can commit suicide. In that low mood, their thinking faculty is shortchanged, and the mind can no longer control the will. And therefore, what happens is the will takes over the mind, and they just jump or do anything haphazard to themselves. So when you admit, you give antidepressants based on, there are many types of antidepressants, based on the peculiarity. There are antidepressants that you will give a patient. The person will get well, but he will have glaucoma. If he's somebody that is predisposed to glaucoma before. There are some antidepressants that once you give, person will not be able to sleep. So you must know when and what to give. But so antidepressants, there are side effects, but you must be able. That's why anybody cannot.
Nobody can.
That's why nobody, social workers, psychologists, and co. Medical practitioners who are specialized in psychiatry are the only authorized personality that can take care of this. But they have to look at other things.
Two questions in one. Antidepressants, can they become addictive? And also the different kinds of drugs that we use in psychiatry, can they alter people's personality?
It's like saying antihypertensive drugs, can they become addictive? My mom has been on antihypertensive for close to, let's say, 35 years. And she's still taking, even last weekend, I still bought sets. The truth is that if she doesn't take it, the BP will go up. But when she takes it, the BP, that can be assured, will remain at the normal. So antidepressants. If somebody has been diagnosed with depression, there's tendency for it to reoccur, because you cannot control issues of life that person will face. So you continue to place on antidepressants, and it is not addictive. You can tailor it down if the person is doing well, or if the person is about to relapse, you review and increase upward. But it's not addictive, it's as you are treating diabetes or antihypertensive drug you're using.
And then can it alter a person's personality?
Well, people have experienced a change in their mood.
Yeah.
For example, I know people that, because what antidepressant does is, for example, your mood, let me explain, your mood is low. You are now using a drug that you want it to be high. At certain time, if you are just using it and you don't come to your doctor, we don't review you, there's what we call anaphylactic reaction, which from that low mood, it will now over. So the person now becomes manic, now become very excited and everything.
Friendly.
So therefore, you must know at what time to. So you must just do this thing in conjunction with the doctors. You cannot see your friend using antidepressant and say, I have depression. What is the name of that drug? Let me go and buy it at one pharmacy and use it, because you won't know when it will tilt you. So, but doctors know when examining you that, oh, the mood is now stabilized. So they now use what we call mood stabilizer. You may now be taking off antidepressants and you'll be placed on mood stabilizer that will now make sure it modulates your mood.
So caveat is, don't take antidepressants anyhow.
Anyhow. I mean, you shouldn't take medication off-counter drug. Nobody will sell antidepressants. Nobody will even sell for you.
Okay.
Nobody will sell antidepressants for you. It's not Panadol, it's not Daga or
there has to be a prescription to it.
It's a prescription.
Yeah.
So, but you've had cases where some people are able to access these drugs.
Yes, so that's why I said story for another day, because
so
yes,
they need to understand that
yes, so
even though you can get access, though you can get access to it,
you shouldn't be able to get it, because it's a drug tailored to individuals and who you are.
Okay, all right. So people often get into unhealthy relationships. How do you know that this unhealthy relationship is starting to affect your state of mental health?
But that's one significant thing that he said about self-assessment. So I think before you go into a relationship, you know who you are. And then once you notice that that relationship has started to affect your person in terms of, like he said, you see the person you're with and your heart is skipping. And you're thinking, am I doing everything the way he wants me to? Am I doing this? Am I doing that? Okay, I always say things like, my happiness is the most important thing in a relationship. If I realize that I am unhappy. So self-assessment, you need to know the things that make you who you are. That determines how that relationship is affecting you. And so there should be no reason why you should compromise on those things. Once you realize that you are being affected, I think it's time you move out of that relationship.
And premarital counseling. People don't see therapists before they get married. Apart from seeing your pastor, your man, whatsoever, whoever you want to see, it is important.
You know, I think there's a mistake with the fact that we think seeing a pastor
is
imam or whatever makes
There's
you...
a client I saw. It's not even a client, it's a friend. And I said, you know what, when you want to get married, haven't profiled your personality. Make sure you marry someone that is at least 10 years older than you. He said, what? I began to tell her who she is, and I think, from my personality assessment, I said, you need to marry somebody that when you throw your tantrums, you just look at it. What is wrong with this one? I said, you marry your peers, it's going to take you up. And that home is going to be hot. He said, you are right. She now told me about previous relationships. And the only one she enjoyed most was the one that was 7 years older than her. I said, somebody must be able to. So these are factors that must also be. Otherwise, you go into it, you are boiling, it's boiling. You are both thinking things in different perspectives. But somebody that is older than you, I'm just not everybody. Yeah. There are some, if it is older than you, it will even cause wahala. Yeah. But some, if you are pair, problem. So, but personality assessment and counseling.
So I just think we have to start preaching the word, not preaching, because you know there's a stigma attached to saying, so abroad someone can say, I'm going to say shrink. Yeah, and they think it's a problem. But here, you don't know that saying a counselor, seeing someone and talking about things just basically is something that would help you.
Yeah. So we're recommending that part of your preparation for marriage,
mental health specialist,
is see a mental health specialist.
Even just not married. Sometimes I think it's good for you to do a self-assessment of who you are with
just the same way
you do mental health. Yes,
exactly.
So like doing a medical checkup is important. That is part of
you know
what
yourself
you do.
And you prepare yourself for that marriage. What are the things I need to draw? What are personalities? I mean, the anxious type. A dependent personality person is always clingy. You now marry somebody who wants you to be self-independent. And therefore, you can't on generator. You can't do anything. Hello, dear. Oh, they've taken light. After some time, the guy is going to feel like, God, is there a liability I've married? You can do it for 1 or 2 or 3 years. That's going to, and they say he's not loving me again. You are seeing people outside, and their marriage crumbles. So we have to be realistic about these things.
Oh, yeah.
Wow. Let's look at this situation where someone is already in a mental health situation, maybe occasioned by a relationship and all that. I want us to look at the case, a case for a support structure. The role that a support structure can play in caring for someone like that.
Well, thank you very much when you mentioned it aside, because as Africans, we've been known for that for a long time. That is this supportive structure. But if you notice in the last few decades, that is becoming eroded. Yeah. We are imbibing westernized culture. Every man to himself, me cool, you cool, everyone goes his way. And that is really affecting the care of those that have an emotional problem. It is very important. Researchers have shown that people all over Africa that develop mental illness, they do better in terms of prognosis, that is outcome, than the Western world. Why? Because auntie, mommy, daddy, brother, everybody, that support structure is there. So also in home, we must understand that we should not say, oh, we should not lose our values. When your neighbor, your sister, or anybody is going through certain things, it's important to come together to help that person. Third party can be a positive influence rather than a negative influence. When you are encroaching into a relationship in an aversive manner, it becomes a negative influence. But if it is your aim is to make sure that, oh, how do we support these people? How do we get them help? How do we help them? It accepts so many. Yeah. And even after admitting somebody and discharging, we still always employ the family not to leave them alone, but to support them.
Yes, it plays a major role, because sometimes you don't understand the gravity of having a support structure. And you know, I think the availability of people all the time just makes a difference, because it also, like, you know, the example that I had given, he ended up in a bad situation, but then I can imagine if she did not have any support structure at all, then it would have been, the outcome would have been worse than worrying, because, you know, eventually even the doctors had advised separation. Remove yourself from it. And then before you know what's happening, she was in a situation where there was the stigma. And so if she didn't have the support from family, she could even have a relapse. Yeah. She'd have a relapse of situation. So I think support
we need to keep our eyes on them from the point of view of showing care
that.
And support and encouragement, you know. So we're going to take our last question. From social media, we always allow people who follow the show to send us questions based on the topic that we're discussing. So this is our last question, and I'll allow both of you to have a shot at it. So it goes like this. I'm in a relationship with a guy that I think is bipolar. When he's calm, he's sweet and wonderful. But sometimes he just flies off the handle for no apparent reason. What should I do? Dr. Nobi. Yeah.
The truth is that bipolar is not a crime. It's like saying you're in a relationship with someone that has diabetes. So the truth is that bipolar being managed?
Okay. Yeah,
if you marry someone that's diabetic and is not being managed, you'll be a widow after a while. If somebody has hypertension and is not being managed, you're going to die of heart attack. If somebody has bipolar disorder and is not being managed, he's going to be erratic, and you or him are in danger. Well, the essence is that I'm happy you know, has this person been diagnosed? The only thing is that if this person is refusing treatment, then your life is in danger. Yeah. And that's the truth. Because in the manic and erratic mood, it can do and undo. So get help. Call his family. Let them get him help. If he's on medication and is on good psychotherapy, he is going to be very, very, very fine. Otherwise, incessant relapses, you may land yourself in trouble.
So the big question is, do I want to encourage him to get help, or do I want to help myself by running away from him?
No, you can't run away. No, it's like running. That means you're going to run away from everyone in life, because We all have one ailment.
Yeah,
or
because
the
I
other,
wanted
bad
to
thing.
also talk about, people with excessive anger. Excessive anger may not be a bipolar situation.
Yeah,
well, I'm not an expert
yes,
in
once
this,
you
but
observe that, you talk to
yeah.
your partner and say, dear, I think you have this. Can we go to therapist?
Yes, and then the
anger
management ways
Simple.
that you could sort that out. So
but you should not just say your anger will kill you one day. Your anger will kill you one day. Before your anger kills you, I will run away from you.
Or I will kill you.
We are
I just think
helpmates.
it's in a place of where we start to reorientate our minds to know that mental health or mental illness is a medical condition and it's not a stigma. So you don't think, oh, I can't do anything about it. You can be that person that will change that person's life just by encouraging that, you know what, if that person even sees that, oh, this person is just available for me to get help, everything calms down.
Yeah.
And then, so I don't think it's a situation of making a right choice. Oh, let me leave him with his problem, or let me leave her with her problem. It's a thing of understanding that it is a medical condition and the person just needs help.
So you're saying that our love should be all-encompassing. So even when people have mental health situations,
you know, I like the fact that he keeps
anger,
relating it to hypertension and diabetes.
Yeah.
How many of us
smart
has
people
left?
have rheumatoid arthritis.
Exactly. How many of us
And you
has
don't leave your
left our
partner.
people because of their hypertensive and diabetes? Those are common. Those are things that are everyday.
Yeah, but this really calls for a mental shift.
It's a mental shift
and a mental
reorientation. It's a reorientation
for
of
all
our
of us
minds.
to know that these situations can be treated.
Exactly.
Such people can be okay.
Yeah.
And it's when we're not just playing to the gallery and we face it with them and we're able to talk to them to say, look, this is a situation that needs treatment and you can be treated.
Exactly.
And it's on that note that I want to say a big thank you to Dr. Nubi and Dr. Sime for being a part of this wonderful discussion on this episode of the Better Half Show. I'm going to come back with one or two final thoughts. So don't go away, stay with me, and I'll be right back. Welcome back. We've been discussing how marriage and relationships affect our mental health. It's instructive to know that there are decisions you can make that can help you to cope with stress in relationship and marriage. We also got the understanding that some people already have mental health situations that marriage and relationships only serve as triggers to bring them out. Whatever the situation may be with you, there are certain things that you must pay attention to. One is to create the right support system around you. Our environment is already very communal. We don't have to pander to the lifestyle in other parts of the world that reduces our dependence on other people, because putting a support structure around you will help you enhance the state of your mental health. I also would like to say that you need to make up your mind to pick signals ahead of time. When you realize that your mood is changing, you don't feel happy like you used to, I think it's time for personal evaluation that may then lead to a professional evaluation that will lead to a state of peace and bliss for your mind. Thank you for joining me on the show today. And until I come your way again on another episode of the Better Half Show, may your marriage and relationships be sweet.